I don't, can we unmute?
Uh,
Am I unmuted?
yes, you're unmuted, Sue
Yes,
Ellen.
we can hear
You're
you.
unmuted.
Right. Well, this
I
was,
hope we represented your device well, Sue Ellen.
oh my God, I'm just overwhelmed. I mean, I'm really overwhelmed. This is such an incredible um, support for this device that has made such a difference for you who are on the front lines and training people on the front lines. This is fantastic. And I know that I hope we've recorded this so that we can post it on our website and let people know. Um, you're right in that we have presented to international relief groups and not definitely have not gotten where we need to be. And where we have to be is with people like yourself, the champions, people who are, again, frontline workers who really know what a life saving and life changing intervention this is. So thank you guys so much for all that you've done, all the lives that you've saved in so many ways. And that's it. Thank you.
Thank you.
Thanks, Sue Ellen. Dr. Bangal, please go ahead.
Yeah, yeah. Good evening, everyone. I'm Dr. Bangal. I'm working as obstetrician in India. I'm very happy to say that I had opportunity to conduct one workshop with Dr. Sulan Miller uh, at Bangalore, if she remembers, maybe some 7, 8 years back. I'm working in a tertiary care hospital with approximately 10,000 deliveries per year. That is the total turnover. And last 10 years, I'm using this um, garment at our place. And it's happy to note that for the first time, I received this from one non-government organization uh, that is called Jeev Daya Foundation from Dallas. The person is from India but settled in Dallas, and they are providing these garments to almost 300 hospitals in India. So I was one of the
Wonderful.
beneficiary, and last 10 years I'm using this and promoting this garment. I must have conducted more than 50 workshops for OBGYNs and nurses in this area, and very happy. I heard whole of the conversation. I fully agree with whatever you both of you have said, and at my place, I have kept this garment at all the possible places where we receive patients, starting from emergency department to labor room to operation theater, also in intensive care unit, wherever we feel that there is likelihood of postpartum hemorrhage. My facility was one of the participants that Dr. Thomas Burke from USA. We conducted one PPH bundle uh, program in 10 medical colleges, medical schools. So I was one of them. And with Thomas Burke also, we learned a lot. He also took us to Boston and also funded us to reach to Dr. Fernandez Critical Care Hospital that is in Colombia. So with this experience, we really learned a lot, and I'm trying to promote this in the whole area. I did bulk purchase of around 50 NASGs 10 years back. And to my fellow OBGYNs, I trained them in a short. We all know that it requires very short training for the OBGYNs to know about how to use it. But not only those, but also peripheral hospitals from where we commonly get the patients of postpartum hemorrhage. So there also we train them. In my hospital also, not only the doctors and the nurses, but those workers, paramedics who are also helping us in the case management. They are also trained in this. And I'm very happy to be associated with this NASG program. And that's why I said to Michelle that yes, I will definitely be there to attend this and learn more about this. So I will stop here.
Thank
Dr. Bangal,
you.
oh no, sorry. I had a quick question because you've been using the NASG for a while. Have you had some NASGs kind of come to their end of life that have been worn out that needed to be replaced since you've been using it for some time?
Yes, uh, mainly in my own labor room, I have those, but immediately they are replaced. And mine is a private hospital, medical college. and
Mhm.
I told them the importance of this garment. Initially, I received it from this Jivdaya Foundation, but subsequently, I could convince my hospital management to purchase them, and then I have replaced them and kept them in good condition.
Excellent, excellent. And you purchase them, are you purchasing them from Visco because they're in India?
Yeah, in Visco, from Visco. And that
Yeah,
bulk
so it's
purchase was also from Visco. Yeah.
right. Okay, fantastic. Thank you so much. Thank you for sharing because I know you have a lot of
Yeah.
experience with this. Wonderful. It's wonderful to hear. Does anyone have questions either to Vicki from Mercy in Action or just very generally about the NASG? I know we have some newer people with us today. Um, Feel free to raise your hand or put it in the, I think we're a small enough group you can unmute if you have a comment or a question.
Yeah, thank you so much, Michelle. This is Karen from Malwala. I really want to appreciate the two presenters for sharing the insights on the role of NASG, on the use of NASG in the US and also in the Philippines in supporting our women to survive. Mine is not a question per se, but just wanted to ask about the collaboration between the Mercy in Action and the Ministry of Health in those different continents, looking into sustainability, where sometimes the government needs to plan to take up the cost, especially when it's come to progressive training of healthcare providers, budgeting for nurses, because I know sometimes we donate, it's never enough, and we need the government to put in some allocation to ensure every facility after NASG and also for replacement in case of wear and tear. And apart from that, just wanted to report that Luala, through the support of Swellen and Michelle, we did a very great job in 2018 up to date, where we've been able to train the healthcare providers from one region to 15 high burden counties and deploying the NASG. And just to mention that NASG is very easy to scale because sometimes it's an investment of many years. So once you have the NASG, at least two NASGs in the health facilities, then you can be able to progressively support the other facilities to access. And within that, around 7 years, we've been able to scale and train 7,100 healthcare providers. This is the training from funding from Luala and also collaborating with other partners to scale and ensure there is high sustainability from the government and the Ministry of Health. So currently, we've deployed around over 2,000 NASGs across over 1,000 health facilities. So it's something that is scalable, and every birthing centers needs to have this crucial innovation to help women who are bleeding, because bleeding happens every day in maternity. You can never predict when will this happen, but we need to be prepared to have all the other components of emotive and have the NASG to support, especially in a resource setting where a hospital or a birthing center is just managed by two midwives, and sometimes you require to transport for consultations. Sometimes you even consult over phone or to the obstetrician to guide on the next steps. Okay, thank you. Yeah.
Thank you, Karen. Actually, and you raise a good point. And Vicki, I don't know if there have been any attempts. I know that I don't think we've worked with you on the idea of trying to escalate it through the Ministry of Health in the Philippines, but I know that we've had conversations with the OBGYN Society and they might be
Mhm.
positioned and they're quite interested. So it might be something that we could try to renew those contacts with
Right,
the Philip
right.
Obstetric Society to see if it's something that they would be interested to take up and perhaps to facilitate a meeting with the ministry to, you know, to have a preliminary discussion about whether they are interested in supporting it in the hospitals.
Yes, and our strategy up to this point has been to make sure that whatever community we are in and physically have a Mercy in Action sponsored birth center, then we make sure that the facilities around us that are also where babies are born have an NASG. And then I know I've talked to you, Michelle, in the past. If anyone wants to or is able to scale it up to a larger degree through the Ministry of Health or through the OBGYN Society, we have offered that any of our midwives could be trainers because we're in several different regions in the Philippine Islands, so that we could offer ourselves to be trainers for sure. Yeah, that would be a wonderful thing to see happen, is for it to be scaled up to a national level.
Yeah. Sorry, and I'm seeing the question uh, from Karen in the chat, and actually, I don't think we have anyone from Tanzania. We have several collaborators in Tanzania. I'm not seeing any of them on the call right now, but I know that there are a few NGOs that are planning to purchase NASGs this year. One of them is Thamini Uhai. Um, I'm trying to think of and I believe also Fame Hospital in northern Tanzania is also planning to make a purchase. So we've got a couple collaborating partners that are working to coordinate along with Panida and Rotary. So I think Karen, I think we can follow up with that separately to because I know that we're hoping that there will be one sort of large order placed for the NASGs to Tanzania this year and save on the shipping costs. As there is going to be an order for Uganda, and I know we have a lot of the Ugandan people here with us today. Yes, absolutely. I will definitely follow up with you, Karen, because it's much better to place the order together than to have everyone pay separate shipments. Or I know that we had with past shipments, there have been troubles with them getting caught in the customs clearance and the heavy fees from the customs. So we're trying to work with Thamini Uhai has good contact with the Ministry of Health, and so we're trying to make sure that we've got some people already starting the process of applying to the Ministry of Health to see that it can be cleared as a medical device that should not be taxed on entry when it's being shipped into the country for Tanzania. So that will be great. And I think, Karen, for Luala, that was probably something that you were able to, that Luala, I think, helped with making sure that the NASGs come in without taxation, right? Or like import fees for Kenya.
Yeah, it's something that's we try in collaboration with Chai to ensure we have the NASGs in our major supply unit for the government, but we've not succeeded. The last order that we did, we were not able to successfully secure tax exemption from the government, so it's still tasked. It is still being tasked, but we are looking forward to where NASGs can be imported as one of the medical supplies, so that we do not have to pay taxes for such, but not yet succeeded in Kenya.
Okay, that's unfortunate. Okay, wonderful. Does anyone else have any questions? Oh,
Thank you so much, Michelle.
yes.
My name is Gladys, and I'm a midwife. I work in Uganda. Basically, I'm based in Mbale as a city, one of the cities in Uganda. I work in one of the regional referral hospitals, and I really want to appreciate so much the initiation of the NASIC. The NASG has really helped to save very many mothers. We had a high rate of maternal mortality in our hospital and in the region because of PPH. But from the time we started using the NASG, I want to tell you that it has helped to reduce the percentage and the number of mothers that we are losing. And being a trainer for Emotive, I've always advocated for NASG. And we always encourage that when we get NASGs in our country, basically from the Ministry of Health and the other organizations like CHAI, JAPAIGO, because they are the ones who are actually trying to support the ministry, we would really think of escalating the supplies to even the lower facilities like the health center threes, because they also do deliveries. And most of our mothers who get PPH in those facilities and there is no NASG end up actually dying during the time of transportation and so forth. So I really want to appreciate so much the initiation of this NASG, because it has helped to save a lot of lives in Uganda, and basically with the experience that I've had in my facility in Mbale. So I so much appreciate, though I joined late, I didn't get all the presentations, but I appreciate you so much, and we advocate for NASG. Thank you.
Yes, yes, yes.
Thank you, Gladys. It's very nice to hear from you. Wonderful. I see also the question from Helen about targeting midwives. Yes, so and Karen, thank you for responding to that. That the in Kenya it's a module in the EMOC training curriculum. So I think for most countries we're trying to make sure that it's getting into the official EMOC training curriculum for midwives, obstetricians, nurses, so that everyone is getting standardized training on the NASG. Of course, it is also tricky when it is in the training and then the supply is not yet there. That can be a bit frustrating. But absolutely, training midwives is critical to moving things forward, and it's a great tool for midwives and for nurses. Sue Ellen?
Yes, thank you so much. Thanks to all of you. I would like to say that one of the ways that we need to make sure the NASG is incorporated into the pre-service curriculum at midwifery schools, medical schools, nursing schools, so that the trainees who come out who are going to work in the field will already know how to use it and will advocate for its use if it's not already in the system.
That is a really good point. And as someone that is directing a accredited midwifery college at the Bachelor of Science level in America, we have made sure that's absolutely in our curriculum. It's not required by our accreditors to be one of the curriculum items, but I think it should be, and I would love to make sure that it is. Um, Again, I will put myself out there if anyone wants a consult on how to incorporate it into a midwifery college curriculum. Anybody on our staff would be absolutely willing and thrilled to talk to you about how to incorporate this into a curriculum and how to. It's actually a thread we make sure follows all 4 years of the school, so it's not just a one-time thought when we study something, but yeah, very good point. It needs to be in all the training.
Yeah, at every level, including I think we should not ignore the ambulance drivers and
Yes,
EMTs who are maybe the first
yes,
line. Vicki, we should go offline and discuss how we can work with the accreditors or accrediting
yes.
people to get this as something that's being used, because I think that would move things forward quite a bit.
Yes, and it might even be I'll have to look it up and see if it's already in the ICM kind of curriculum standards. Maybe you know if it has reached there yet, because that would be a good place for it too.
Yeah, I'm not sure that it has. Whoops. I'm muted. Sorry.
Okay,
I'm not
well,
sure that it has, but we can investigate that because that would be another angle that we could follow up on in Portugal.
great. Yes, because they did accept Ian and Rose's abstract to teach a workshop on the NASG, which told me two things. One, they appreciate it and want it taught. Two, it's not something that's already standard care, and they know it's not, and that's why it would make a good workshop. So,
I think so. Okay, we'll talk offline.
okay.
Oh, and I just wanted to add the response for you. I mean, I think in Uganda, because it's been very recently introduced, that it is the NASG is being used in in-service training. But I think that that is a good point as the PPH committee, as the National PPH committee is moving forward to look at, to make sure that they consider putting it into um, the midwifery training curriculum. It's a very good point of note. Fantastic. Well, this has been a really great conversation. I would just like to take a moment to think about scheduling our next call. I think perhaps for mid-May we would be looking at sticking with a Monday. Sue Ellen, do you have, and Andy, do you have any thoughts if we looked for a date around May 11th or 18th?
Currently, I don't have any conflicts, so let's get it on the calendar soon so we
Oh,
can block it out. Thank you.
okay. Can we say May 18th? Does that date work for people? Are there any kind of national holidays or something we need to be mindful of? Okay, got a thumbs up from Andy, from Karen. This is great. Lots of
Okay.
thumbs up. Okay, fantastic. So we will plan on May 18th. It will be at this same time for the US. I think it will be 1 hour later for the UK and Europe and Africa, I think, because we're at that moment between the daylight savings time, so our time differences are a little bit off. So watch for it maybe being within an hour of this time, folks. If you have suggestions for topics or things you'd like us to be covering at the next meeting, but otherwise, it's been fantastic to see everyone. And for those of you who have, I know that for Uganda, we're working on a collaboration for Tanzania as well. Um, Feel free to reach out to me, or I'll be reaching out to a lot of you, and we're going to keep those things moving forward.
Great. Thanks to everyone for attending, asking such good questions, inputting so much information. Vicki and Rose, of course, kudos. You're doing such great work. And I'll talk to everyone in May. Thank you.
Thank you,
Thank you for
everyone.
having us share. Blessings, everyone.
Thank you. Bye.